International flights. How are other countries implementing the PA profession? Created by India Rose Bane, Darian Bott, Naufa Chowdhury, Emily Francis, and Gabriella Woeste. Illustrated by Naufa Chowdhury. In the United States, PAs are medical professionals that are increasing in number daily, currently practicing in every state, in every medical setting and specialty. In the U.S. alone, there are over 123,000 PAs practicing. PAs work in team practice with physicians and other healthcare providers. They are licensed to diagnose illness, develop and manage treatment plans, and prescribe medications. Before practicing, PAs are required to attend a master's level accredited PA program within the United States. They must then successfully complete the national boards exam known as PANCE. PAs must also sit for a recertification exam every 10 years. While the demand in the United States has increased 300% from 2014 to 2017, let's take a look at the role of the PA profession internationally.
As many of us already know, the PA profession is relatively new, but this is even more so in the Netherlands. The PA profession was only introduced in the Netherlands in 2000 after much cooperation with the United States. The first accredited Dutch PA programs began in 2003 in Nijmegen and Utrecht. Shortly after this, in 2004, 3 more programs were added, bringing the total to 5 PA programs in the entire Netherlands. These programs are designed in a similar way to those in the U.S., the main difference being a dual work education model. This is where students are employed 2 days a week under the supervision of a physician mentor in a specific field of medicine during their education. Additionally, in order to be considered a candidate for the programs, the students must not only be fluent in Dutch, but English as well. Currently, there are about only 1,000 PAs working in the Netherlands. 72% of them are women with a mean age of 31 to 40 years old, and 28% of them being men with an average age of 41 to 50 years old. Although limited in number, PAs have already greatly affected the country in providing better quality medical care to patients, along with vastly improving the productivity and efficacy in pre-hospital and hospital care. In order to extend their licenses, every 5 years, PAs must complete approved accredited activities such as national or international PA meetings, registered specialized master classes, e-learnings, and much more, only to renew their licenses for another 5 years.
Originally, when the PA profession started in India in 1992, there were only 14 students, and the completion of the program earned a postgraduate diploma in cardiac surgery. It soon became a 4-year Bachelor of Science degree that composed of 3 years of academic and 1 year of internship in a chosen field. As of 2014, there are 47 PA programs and more than 1,000 graduated PAs. Interesting to note is that the PA profession came about in India out of the need for more help in cardiology and cardiac surgeries, which is why a majority of the PAs are involved in cardiac procedures in the surgical and outpatient settings. The roles have been expanding such that they are more involved in primary care as well. One of the challenges faced in India is that the PA curriculum is not standardized. This, coupled with the fact that there's no national licensing exam for the PA graduate, can lead to substandard education and some uncertainties. The education now is focused more on general medicine instead of just surgery, so that PAs can be expanded to the primary care fields. The roles and privileges for PAs in India are similar to those in the U.S. PAs are not only involved in the clinical side of patient care, but they also play an important role in research and scientific publications. Important to note, each medical facility will train a PA to their needs, just like in the U.S. However, most PAs work in private institutions because the PA profession is still not recognized by the government. For now, there's still a need for PAs in India, especially in the rural areas for primary care.
The introduction of PAs into Canada began with the Canadian Armed Forces, originally termed medical assistants, until 1984 when the title officially changed to be physician assistant. Despite physician assistants' presence in Canada since the 1960s, they are not fully incorporated into the healthcare system. But with the number of physicians retiring and the aging population, the push for physician assistants to play a larger role in healthcare is in the works. Out of the 10 provinces in Canada, only 4, Ontario, Manitoba, New Brunswick, and Alberta, recognize physician assistants as members of the healthcare team. Currently, there are only 4 schools accredited by the Canadian Medical Association in Canada. Certification in Canada requires each student to pass their PA-CCC-PA certification exam in order to be designated as a CCPA, which stands for Canadian Certified Physician Assistant. In the workplace, PAs may conduct patient physical exams, perform selected diagnostic and therapeutic interventions, provide medical orders and/or prescriptions, counseling, and assist in surgical procedures. Canadian PAs are primarily found practicing in primary health and internal medicine specialties. However, PAs can be found in every specialty and in varying settings. The future of PAs in Canada is uncertain because PAs are not regulated and they work under a 2-year contract. However, as the apparent need for healthcare practitioners in Canada and the knowledge of the importance of PAs increases, the number of provinces allowing PAs to practice should follow suit.
PAs, referred as physician associates, were first introduced to the UK in 2003, and in 2005 the first 5 PA programs began along with the UK Association of Physician Associates. According to the 2017 census, there are now 30 PA programs spread throughout England, and they are designed similar to those in the US. In order to attend PA school, one must have an undergraduate degree, usually in a biomedical or health life science field, and have prior healthcare or social care experience. The programs are 2 years long, and the first half consists of theory followed by clinical practice. Most programs offer a postgraduate diploma in PA studies, while some offer master's qualifications. Once the program is complete, students must take a national certifying exam, also referred to as the PANCE. PAs must maintain their continuing professional development with a minimum of 50 hours annually and have an annual appraisal with their supervisor. They must recertify every 6 years in order to stay on the register as well. PAs in the UK have many of the same duties as those in the US, including taking medical histories, performing physical examinations, formulating differential diagnoses and management plans, requesting and interpreting diagnostic studies, and more. However, PAs are currently unable to prescribe or request ionizing radiation, including chest X-rays and CT scans. PAs are dependent practitioners working under a medical supervisor, but are able to work autonomously with the appropriate support. Currently, PAs are not statutorily regulated, meaning they work under a delegation clause, so the doctor delegates what they can and cannot do. PAs work in all of the same settings as those in the U.S., but the majority are in general practice and acute medicine. There are approximately 450 PAs working across the UK currently, with 75% being female and mostly in England. However, there are about 75 PAs spread throughout Northern Ireland, Scotland, and Wales. It is projected that by 2020 there will be 3,000 qualified PAs and potentially 1,000 graduating per year in the UK after that.